Hi, good evening to everyone. I'm Dr. Philip McMillan. Thank you for joining me. As today we're talking about the fact that the New York Times actually acknowledges COVID vaccine side effects are real. They even went on to say that deaths are vanishingly rare. Now, it may seem like, why are we talking about this? Well, it's largely because this is the kind of thing that needs to be discussed, it needs to be openly acknowledged because they are recognizing that this is occurring. This is the headline from the article that I'll be going through. COVID vaccine side effects, four takeaways from their investigation. Can you believe after 3 years they are actually willing to investigate it? So, additionally, we'll be talking about the issue about deaths being vanishingly rare. And when we had the Unstoppable Mothers Against Vaccine Injuries, Hetty Simoes, whose son had died, was actually making the point that we are not doing adequate investigation. So I'm going to be sharing with you an update with regards to their preprint publication, sadly, on her son's death. Before we start, as usual, just to give you some important updates. Coming up shortly in another few days is part five of our advanced COVID series, COVID Symptoms Essential Facts. This is where we're going to break down all of the symptoms from mild, asymptomatic to mild to severe. So if you are interested in that, please register in the link below. It's connected to the fact that we have got here our advanced 360 course. This is what will be part of it. We've done part one about viruses, part two about immunity, part three. So, this is one of the most comprehensive courses you'll ever come across. So, if you want to join us in that journey, please do. We're very happy to have you along. So, getting back to the question about COVID vaccine side effects being real, I've highlighted a few points in relationship to this article, and I just thought I'd take you through them before going on to the question about whether or not deaths are actually vanishingly rare. So, let's start with a few points. So, when we look at this, so this was published on the 3rd of May. So, you can see it here, 3rd of May 2024. And it was by Apurva Amandavili. So, it's wonderful that she was doing the investigation about people saying they had experienced side effects. So, she highlighted that thousands of Americans believe. Now, this is the first crucial point. They're not saying that it's real, they just believe it's real, that they have rare but serious side effects. But confirming a link is a difficult task. Now, without a shadow of a doubt, that is true because that only happens when you're actually doing proper research on it and you are genuinely trying to find answer. VAERS had huge numbers of reported incidents, but this was ignored because they didn't believe them. So, how are you going to find out about the side effects if you don't believe the people who tell you about it? Now, the next thing that I'd like to highlight here is that the vaccines turned the pandemic around and opened the path back to normalcy. They prevented about 1.4 million deaths worldwide, according to one estimate. Now, I've already dealt with that. I recently asked about Africa. How are you going to explain Africa? How do you explain Bulgaria? How do you explain Papua New Guinea? These places had low vaccination rates. They haven't got a problem in terms of their ongoing mortality rates. So, if you haven't addressed that question, you have to be careful about putting credit to what you're not sure what the credit is for. Not saying that there isn't any benefit with regards to severe disease. Now, I find that people seem to get upset when I say that. This is just science. Without a doubt, you had some degree of benefit against severe disease. What I, however, say is that whether or not that impacted on all cause mortality, meaning that did it mean that it actually saved lives? That's not clear because we still have significant excess deaths occurring across the world. Getting back to this article here, for most people, the benefits of COVID 19 vaccines outweigh any risks. Now, and they are acknowledging even the best vaccines and drugs have some side effects, but that does not negate their benefits. Now, listen to me very carefully. When we were looking at using vaccination, and even though I was looking at autoimmunity and I recognized some of the risks that it would occur, even at that point, I wasn't saying for the high risk that you don't do it because I recognize that there could still be benefit to preventing severe disease. But once you go to the low risk cohort, you better not have side effects or deaths. That's the reality because that low risk cohort was at such a small risk of severe disease. And when you add in the fact that they could have had early treatment, people didn't need to die, especially the low risk cohort ones. And so that now becomes an issue when you start rolling into the side effect issues. Now, I'm going to continue with talking about the side effects before I come to that question about deaths. Here is another thing that they highlighted. Proving that vaccination led to an illness is complicated. That's right. Among hundreds of millions of Americans who were immunized against COVID, there were deaths, heart attacks, strokes, miscarriages, and autoimmune illnesses. How do we distinguish illnesses caused by the vaccine from those that would have happened anyway? Big question. And you only know that by looking at big data and looking at correlations. You have to remember that the smoking lobby used that kind of argument to cover up smoking harms for almost 40 to 50 years. So if you're not looking at the data and you're not trying to correlate and analyze stuff, then no, you're not going to see any connections. Now, again, coming back to the article here, understanding the full range of side effects may take years. Actually, the rate they're going is going to take decades. Now, they've looked at the federal databases and they said thousands of Americans have reported that COVID vaccines cause ringing in the ears, dizziness, brain fog, fluctuations in blood pressure and heart rate, new or relapsing autoimmune diseases, conditions, hives, vision problems, kidney disorders, tingling, numbness, loss of motor skills. And what they're saying here is that they're not sure that these issues are actually real. Now, for the people who are suffering it and they hadn't suffered it before, and the only correlation they can find is that they had been vaccinated, I don't know how you're going to discount that. One of the interesting things is that most people who talk about this don't actually know a lot about the science as to what happens. I can't cover it fully here, but I'll mention just one simple thing about hypermetabolic lymphadenopathy after vaccination. They found in Israel, looking at PET scans, over 1,000 patients. We're talking about 3 to 4% of all those people who were vaccinated were found to have abnormally high lymphadenopathy or inflammation in the lymph nodes. This is significant because it shouldn't normally happen. And we're talking about 3 to 4%. Now, if you put that across a population, suddenly you will realize that yes, this could be very, very relevant and shouldn't be ignored. Now, the standout comment for me was this one. Deaths from vaccines are vanishingly rare, despite claims from some conspiracy theorists that vaccines have led to a spike in mortality rates. I'll let that sink in. They've acknowledged here that there is a spike in mortality rates. They haven't delineated what the cause of that spike is. This leads us back to that good old friend of ours in the room. There is an elephant in the room. You can say what it is not, but you don't know what it is. That is completely illogical. You either know what it is or everything is on the table. That's the problem at the moment. There is not enough investigation. So we have a situation where we don't understand about the deaths. I come back to that point. The deaths are vanishingly rare, they said, despite claims. Now, here is an example, and this is why I brought up this story, Unstoppable Mothers Against Vaccine Injuries. Hetty lost her son, and she was determined to find an answer. And she luckily had the help of Dr. Balbona, and he helped her to get to an answer. And that's the other part that we're going to cover very, very quickly. They've got it pre-printed here, and this is a paper about case of myocarditis, pericarditis, and fatal aortic dissection after mRNA vaccination. He was only 34 years old, he was in good health, and 16 days after his first dose, he experienced acute inflammation, dissection of the aorta, and tamponade. Sadly, he died. Luckily for the world, his mother, and I guess his family, didn't stop looking for answers. He was not considered to be a vaccine injury death. And I can't understand how anyone could discount it without investigating. And that's effectively what happened, in the sense that he did have an autopsy. They saw the dissection, but they couldn't confirm exactly what caused the dissection. So he had family tests looking for various things and so on. The point being is that if you don't know, how do you then exclude a particular issue? I'm going to show you a few slides because this is relevant to what the autopsy that was done leads us to. First thing is to understand again the basics. This is the principle of this is the heart. The heart is connected to the aorta. This big trunk, this is the biggest blood vessel in our body, carries blood from the left side of the heart to the whole body. And it does this beautiful arch. It goes down to the legs, both sides, feeds off the kidneys and the intestines and so on. Then it has branches going up to the brain and to the arms and so on. So it's the most significant blood vessel here. And one of the things that can happen is that we have a dissection where it tears. It's a tear, and depending on where the tear occurs, it can go down and then cause blood to leak around the heart, which is what happened in his case. He had pericardial tamponade. And this is what it looks like. So this is the artery, a cut section of the artery. So it's big, lots of muscle. Inside here is the endothelial layer. And in his case, what happened is that there was a tear in this lining. Blood then pushed through into the muscle and then tracked down to then get into the heart. And it was because so much blood would have gotten around his heart that he would have died. This is a pretty serious complication. It's one of the few real medical emergencies where you have to act very quickly. This is another image of the aorta. And the reason I'm showing you this is so you understand the pathology. And again, inside here is the smooth lining, the endothelial lining. He had the tear that went through the tunica intima into the media, and then it went into the muscles and went down. But what you have to notice with the aorta is that it is so big that even having blood, oxygenated blood in here, can only feed a small amount of the lining around here, the blood and the cells just on the inside. But all of the muscle primarily gets its blood supply on the outside. It's what we call a vasa vasorum. They carry blood supply and they supply all the way around. So all these little red and blue are arteries and veins carrying the blood supply. This is relevant because in the context of what happened to him, it was because of damage to the vasa vasorum that caused the problem. So I'll take you back to now the paper. So, as I said, this occurred 16 days after he had his first dose. And what you then have to look at, this is why we need autopsies, is that without autopsies, anything anybody says, if you haven't actually been doing really thorough autopsies with histological analysis, you don't know. You're just guessing. Somebody dies, you say, well, I haven't seen anything. How are you going to know if it was vaccine related if you haven't done histology? Only histology will tell you that, nothing else will. So it highlights in this paper that he had pre-morbid investigations. He had an echocardiogram. It had no evidence of any problems with his aorta. He didn't have an aneurysm. He did have a bicuspid aortic valve, but that was okay. None of his family had any conditions as well. So part of the problem is usually, how do you exclude that it's not something else? Now, I'm going to show you some important information about what they found on histology. Histology is when they take a piece of the tissue, put it under a microscope, and then look at it. We still have an elephant in the room, and we still need to do adequate research to try and figure out what is going on. They estimate that only thousands have been affected. But I guarantee you, if people understood the extent of the symptoms and the characteristics of the symptoms, we could be talking about millions. But most people are completely unaware that their potential illness could be connected because nobody seems to care. Nobody seems to want to find out because everything seems to be purely about finance and politics and not about the health of the population. Let's hope that in the future, a world will come where even when, as we have in medicine, a duty of candor, which we are required to follow, where if there is a problem and we have made a mistake, we have to inform the patient. Clearly, that duty of candor does not exist in the political arena, which is why we still don't have any answers, because no one seems to want to find out. Again, thank you very much for being with me. Look in the description for the links. Join me on Thursday or join me for the full advanced course. We're looking forward to working with you, and have a great evening.